Hi, this is Dr. Kolodenker, and we're going to go over a distal transmetatarsal amputation today. Prior to doing the surgery, you want to use a marking pen and draw out your incision placement. The amount of skin that you take off should be just the right amount. Basically, you want to go just proximal to the necrotic edges, making sure that you are going into healthy skin to increase chance of healing, and leaving as much skin as possible. I typically use a 10 blade and go directly down to bone with the incision. This elevates a thick flap. There's really minimal other dissection that is needed. Try to keep the blade perpendicular to the skin, and a 10 blade seems to work best for the initial cut. Same thing on the plantar surface, keep perpendicular to the skin. Try to anchor your hand against something so you don't accidentally slip. These are salvage procedures that are done to minimize further progression of necrosis or infection. In this case, you can see that the gangrene is dry. It has been here for approximately 4 or 6 weeks. It starts to mummify. Now I use a key elevator to peel back some of the periosteum off the metatarsal shafts. Since this is a very distal type of amputation, the osteotomies are performed at around the necks, just proximal to the necks of the metatarsals. Typically recommended is starting with the second metatarsal. This one is going to be the longest. Left metatarsal, you want to remember to create a good parabola, weight-bearing surface that is even for walking. And so the osteotomies are made from dorsal to plantar and distal to slightly proximal. As you get to the fifth metatarsal, you slightly angle it a little more, so that way it's distal lateral to plantar medial. And the opposite is done on the first metatarsal. It's going to be distal medial to plantar lateral. I have a tourniquet inflated at this time. Minimizes the bleeding. It allows this procedure to be done a little faster with less blood loss. Make sure that when you go to take out the first metatarsal region that you incorporate the sesamoids. The sesamoids should not be left behind. Here you can see the flexor tendons. The sesamoid apparatus is attached to the plantar first metatarsal head. Here I use a 15 blade. It is more accurate, and just go above the flexor tendons. The entire forefoot will come out in one piece. Things to be careful with is when you do end up making these osteotomies more proximal, you've got that dorsalis pedis artery to worry about that you got to make sure is going to be clamped off. A lot of times it needs to be tied off. When the osteotomies are this distal, usually just cauterizing is sufficient. So the forefoot's come out. You're going to see the flexor tendons remain. Those need to be pulled and cut. They are avascular. So there's really no reason of having them around. You can use a pickup. So at this point, the tourniquet's deflated, flaps evaluated, you're going to notice some bleeding. Utilizing a cautery is going to be enough. Irrigation was done, and then gloves should be changed. So now you begin the clean part of the procedure where you're suturing things up. Remember to handle the skin edges with a lot of care. Don't pinch them very hard, and then don't tie this overly tight to create too much tenting of the skin. I usually end up using a 3/0 or 2/0 Vicryl for the deeper aspect of the suturing. Bring the flap together, and then I bury my knots. After that, we're going to use a Prolene suture, mix between 2/0 and 3/0 Prolene with simple sutures and sometimes horizontal mattress when needed. Sometimes you're left with a dog ear, so appropriately take care of the dog ear. And remember that best option is to remain non-weight bearing during the healing process, which can take 2 or 3 weeks. The less walking that is occurring here, the more likely the skin edges will come together, and then it will make for a much faster recovery for the patient. Early weight bearing can create a lot of dehiscence in the flap, and then you're dealing with wound care issues. For final pictures and final results, you can visit the link on the bottom of this video. You'll see I'll take periodic pictures, and you'll end up seeing the final product on the website. If you have any questions about transmetatarsal amputation, feel free to post. Have a great day.